Thank you, Cam. It's a pleasure to be here. It's a little bit like carrying coals to Newcastle to come to talk to this audience about knowledge translation and impact assessment, because much of what we do and what I've done, I've learned from the Institute for Work and Health and other organizations within Canada. So I hope I'll be bringing back to you some additions to that learning. I would like to acknowledge Dr. Nachemson's work and focus on evidence and the importance of evidence in decision-making to affect workers. And I hope that I can pay tribute to him by resonating with that theme today. I'd also like to acknowledge my colleague, Dr. Sarah Feltner, who helped me develop this presentation. And I would also like to acknowledge the numerous colleagues at NIOSH whose work I will be talking about to you today. Now, in the field of occupational safety and health, historically, we didn't spend a lot of time thinking about impact and assessing impact. The hazards were too big. Impact assessment wasn't a priority. Doing something about the hazards was a priority. In many cases, what to do was apparent. The utility of an intervention was apparent and intuitive, and the value of reducing exposure to the hazard was intuitive. And this worked well for a while, and consequently, many of the serious problems in occupational safety and health have been addressed. And so we can see over the period since the 1970s a drop in non-fatal occupational injuries and illnesses. And we can see a drop in fatal occupational injuries. And so, for the most part, this first approach made some sense. Unfortunately, the decrease in injuries and illnesses has not been to tolerable levels, and more work needs to be done. And what remains are the hard-to-get-at problems, the core problems. And in the U.S., as in Canada and most countries, the burden is still large. And so in the U.S., we have this tragic list of 12 workers being killed on the job a day, 44,000 over the year, 3.7 million serious injuries, 181,000 work-related illnesses, deaths, 47,000 deaths from illness, and costs that are acknowledged to be underestimated at $250 billion in direct and indirect costs. We also have untold pain and suffering in workers and in their families. Now, with this as backdrop, internationally, there has been a move afoot among governments to better understand the impact of where they're allocating their funds, and particularly in the area of publicly funded research. In the U.S., this was brought about by pressures of a large and increasing deficit and the drive to reassess programs across the federal government. There was pressure by the Government Accounting Office for government agencies to update their thinking about their priorities and where they allocated their funds. And part of this pressure was to stop just counting things and start looking at the effect of what this investment was doing, the impact. And so look at outcomes rather than outputs, in the language of logic models and so forth. And so they defined outcomes as how the difference that federal programs make in people's lives. And so this is the backdrop of governmental activities that I want to explore with you for a moment. And it started in the U.S. With many different pieces of legislation, but the most notable was in the early 1990s when the Government Performance and Results Act was developed. This is known as GPRA, and it required each government agency to assess their performance on an annual basis. It was a bipartisan bit of legislation, which is unique in Washington at any time, but certainly was driven bipartisanly at that time. Then in 2003, the Bush administration added something to it known as PART, the Program Assessment Rating Tool, which I'll show you in the next slide. And then in 2010, the GIPRA was modernized to not only look at individual departments, but look at across departments to see how they collaborated and how they worked together and what their performance was in reaching cross-cutting issues. The PART tool was an effort to quantify the performance of government agencies in terms of their effect, and it had a scale that went from effective to ineffective, and you can see an example of it in this slide. Now, we all know who are in the field of occupational safety and health, or who give it any thought, that it is difficult to assess the impact of guidance and research. The scientific researchers do not control the workplace. And so there is a large gap between the conduct of research and the management of workplaces. And there's intervening factors, jurisdictional, social, legal, political factors, that make it difficult for the evidence of research to be transferred into the decision-making of employers. And so I'm going to talk to you today about how we've gone about thinking of the impact that we at the National Institute for Occupational Safety and Health, or NIOSH, have made over a 20-year period. And to give you a little background, let me tell you what NIOSH is. We are the predominant research agency in the U.S. in occupational safety and health. We were formed in the 1970s by the Occupational Safety and Health Act of 1970. And in their wisdom, Congress put the regulatory and enforcement function in the Department of Labor and the science and guidance function in the Department of Health, hoping, they thought, a bit naively, to keep the politics out of the science. Clearly, we know that that is easier said than done. The enforcement part is done by the Mine Safety and Health Administration, or MSHA, and the Occupational Safety and Health Administration, or OSHA. NIOSH was put in the Department of Health, now called the Department of Health and Human Services, and it is part of the Centers for Disease Control. NIOSH has 8 locations. Our headquarters are in Washington, D.C., and we're located in 7 other cities around the country. Our focus is identifying and researching hazards in the workplace through laboratory and field studies, also training safety and health professionals, and recommending occupational safety and health standards, and developing guidance to prevent occupational injuries and illnesses. We have about 1,700 employees in these 8 locations. Our budget is about $649 million. That seems like an awful lot, but when you see that 332 of it is for actual occupational safety and health activities, of which about 100 million of that is for grants to academia. An additional $268 million is used to manage the cohort of workers and residents involved in the World Trade disaster on 9/11. And another $49 million is to assess the probability of causation of disease in nuclear armaments workers who are then eligible for compensation from the Department of Justice. And so together that is our budget. Now, the background to our thinking about impact assessment has some external features, and these are 3 of them. One was that in the 70s and 80s, in society in general, there's been a shift in the relationship between science with society, and a so-called Mode 2 science came about. This is science in the development of application, or in the context of application. And the Swiss sociologist Helge Nowotny and her colleagues really sort of can describe it best with this quote: "Science could no longer be considered an autonomous space clearly demarcated from others of society, culture, and economy." And so the idea of a more applied view of science was a critical societal phenomenon that was growing in the 70s and 80s. Another emerging concept was that of knowledge management, where knowledge was considered as an asset to be managed in corporations like other more tangible assets. And so, indeed, a whole field of knowledge management sprung up such that, and it was triggered by the thinking that if we thought about knowledge in terms of management strategies, we could better utilize it. And in fact, the president of the Hewlett-Packard Corporation is known to have said, if we knew what we knew, we would be 30% more productive. And so that was sort of the idea of knowledge management. And in fact, it wasn't until the early 1990s that knowledge was used as a variable in macroeconomic theory. So indeed, this was another wave in society that influenced NIOSH in thinking about impact assessment. And then finally, growing out of the New Deal and essentially almost peaking in the 1980s and early 90s was the criticism of big government. The complexity of government and the size of government was overwhelming to many in society, and consequently there was a call for reducing it, for cutting out the waste, fraud, and abuse. And indeed, one response to this was the need to better demonstrate that government agencies made an impact. There were a couple other, 5 other background efforts that I wanted to tell you about that were internal to NIOSH. So one was the total quality management movement. I'll go through each of these. The total quality management movement was proposed by the engineer W. Edwards Deming, who was responsible for the quality surge and productivity surge of the Japanese economy in the 1980s. And it became a philosophy that was popular in the business community in the 1980s. It calls for, among other things, respect for people, empowerment, training, but it also calls for continuous improvement. And that means to follow what was known as the Shruhart cycle, or the plan, do, check, and act cycle. You may be familiar with that. And the concept of continuous iterative checking in that process was a formation for thinking within NIOSH of being more formal in our impact assessment. Also at that time, NIOSH, which had always thought about important things, moved to be more of a goal-driven organization, and so that we would have explicit goals and hence something that we could test against in terms of impact assessment. So we moved and we formed what was known as the National Occupational Research Agenda. And this was an agenda not just for NIOSH, but for the whole nation, for the whole U.S., because it was based on the realization that no one agency in a country can address all the occupational safety and health problems. There weren't enough resources. And so to do it, we had to partner, and we had to partner around priorities that people agreed on. And so we identified at that time 21 research categories. And the idea of this was that we would draw in from various stakeholder and other groups in society ideas, inspiration, visions, and we would try to come up with shared visions. And so partnership was a critical feature as a foundation for NIOSH conducting impact research. one of the ways to determine whether your work is relevant is if stakeholders say it is relevant. And indeed, that was part of the thinking with regard to establishing the National Occupational Research Agenda. A third feature, which was part of the National Occupational Research Agenda, was the emerging science of intervention effectiveness research. This is pertinent to impact assessment, and interventions can be thought of from the micro to the macro scale. So you could have a tool as an intervention, but you could have a whole organization, such as NIOSH, as an intervention. And you could use scientific principles born out of clinical trials and health services research, evaluation research, prevention effectiveness research to assess those interventions. And indeed, NIOSH became a strong proponent of a scientific method for intervention effectiveness research. We held a critical conference in 1994 and then formed a work group which developed this seminal publication with scientists from the Institute for Work and Health in 2001, which to this day is still a landmark document for describing the field of intervention effectiveness research. Dr. Linda Robson was the lead author on this, along with other NIOSH colleagues, and Dr. Harry Shannon as well. And so we appreciate their efforts and really want to compliment this as a publication that is still giving. To assess impact, you have to make impact. And so in 2004, NIOSH established a research to practice effort. And this effort focused on, and this is the Coal to Newcastle's idea that many of you know so well, that we have to transfer and translate knowledge, intervention, and technologies. We have to translate the findings of our research into practice. We have to be able to move people to action with our research. And so this research to practice approach was developed by NIOSH, and it was inculcated in all the efforts that NIOSH conducted, such that we attempted to obtain the input of stakeholders at the beginning of a research study, not after it was done, where we just offered them results of something that they weren't even aware of. And so we asked, what are the problems that you face? We tried to fashion the research to address those problems, and consequently, when we were finished with the research, we expected that there would be waiting stakeholders who would utilize that research. And to some extent, that works, but it doesn't work as well as we would hope, and we still have to keep perfecting it, and I'll talk more about that. But we need to have an emphasis on making an impact so that we can then have something to measure. So we have to put resources into making an impact. The last thing of an internal nature that influenced our thinking about conducting impact research was we were now in the second 10 years of the National Occupational Research Agenda. We call it the second decade of NORA. And we switched from just a generalized set of research priorities to looking at it on a sector-by-sector basis. And so we had 10 industrial sectors. And in each of those sectors, we worked to establish priorities. So there wasn't just overarching priorities, there were also sector-specific priorities. This was one of the requests of many of the stakeholders in those sectors for us to do. And it's been a very effective means of developing programs and communicating and translating research to practice. To get this kind of sector-based approach, we held a series of town hall meetings all across the country. We got 800 plus submissions as a result of those. We got web-based contacts. And we put all this together and formed for each of the sectors a council made up of stakeholders, scientists, and other interested parties. And we asked the sector council then to develop an agenda for their sector. And this sector then, council, using their expertise, other stakeholder expertise, surveillance data, set priorities in a draft strategic plan. And the plan was not just an overarching plan, but it had detail, it levels of detail. So strategic goals, intermediate goals, activity and output goals, performance measures, and then it explicitly stated what each partner would do in the effort. So now with that as foundation, I now want to show you 20 years of impact assessment at NIOSH, and what we did in terms of trying to assess our impact as an agency or the impact of our programs. And so I'll show you 5 critical areas where we work. The first involves protocol-based studies. Here's 3 examples. In the 1990s, there was growing awareness that healthcare workers were experiencing allergic responses to the increased use of latex in gloves because more adoption of universal precautions. And so we did a study of the impact of that alert on changing practices in hospital workers. We had another effort where we assessed the adoption of firefighters to guidance by NIOSH research publications in changing firefighters' knowledge, attitudes, and behaviors. And then the third effort was to look at the Fatal Accident and Control Evaluation Program, or FACE program, which is a state-based assessment of fatalities, and look at the extent to which states' membership in that program affected its injury rates. And so I'm going to drill down into that a bit to show you that particular one. So the Fatality Assessment and Control Evaluation Program targets selected fatalities in a state to investigate. It examines the contributing factors. It examines such things as the level of supervision, the extent of safety training, design issues, employer commitment, presence of safety programs, and it makes recommendations to prevent similar kinds of events. And the idea is that following from left to right along this logic model, that it will eventually change knowledge and attitudes and eventually change behaviors of management and of workers. And so for this study that I'm going to talk to you about, there were 2 endpoints that were assessed: fall fatalities and electrocution fatalities. And the study design was a longitudinal design, retrospective time series kind of design. It used outcome, the fatality rates were the outcomes. The data was gathered from a surveillance system known as the National Traumatic Occupational Fatalities, or NTOF surveillance system. And the main effect in the study was whether or not a state was a participant in the FACE program. In other words, whether the state allowed investigators to come in to do this in-depth investigation of fatalities. In addition to looking at the participation in the FACE program, various covariates, as shown on this slide, were assessed. And the findings of this approach were that there was a borderline significant effect on fall fatalities. Here, the measure of significance is the risk ratio. In this case, you're looking for a risk ratio that's less than 1.0. And so the finding of 0.92 with the confidence interval that captures 1.0 was considered by the investigators as borderline significant. And then for the electrocution rates, using a 3-year lag, there was not a significant finding. Now this is an intriguing factor about doing impact research. one would generally look at these data and say they're not very significant at all. Yet the investigators chose to speak more from their feelings of how this fit in with the total process evaluation that they had done of this program, rather than letting the data speak for themselves. This is one of the issues we run into in conducting impact research or evaluating programs that we intuitively think are good. We sometimes find answers that sponsors or other stakeholders don't want to hear. And so this takes a certain amount of intellectual honesty to be able to do this kind of research on a regular basis. And one of the ways to address whether or not stakeholders will hear the results is to involve them early in the planning of the research. Just to show you some of the data from this study, you can see the face states are the yellow diamonds, the gold diamonds. They're all less generally than the green non-face diamonds for falls, and then this is for electrocution. But in no cases are they really significantly different. And the critical feature about this, and I won't go into it in too much depth, other than to say, when we do the reports for these studies, for these face-related states, we distribute them to all the states in the country. So the non-face states in this study were essentially given information that the face states were given. So in a sense, there was some contamination of the comparison group, which might have accounted for one of the reasons why there wasn't a statistical difference between them. Also, the amount of person power to investigate fatalities in these states was limited, and so only a small proportion were actually studied. The next area of impact assessment, so those were the protocol-based studies, just attempts to look at an individual intervention and see if there was an effect. The next approach is to look at large programs within NIOSH. And so we enlisted the National Academy of Sciences to review 8 programs that NIOSH has. Some of them are disease or outcome specific, some of them are sector specific, some of them are cross-sector. And we also enlisted the RAND Corporation to help us develop a way of communicating what the impact was of those programs so that the National Academy of Sciences could better evaluate them. And so the RAND program devised this logic model for us, which essentially is the classic input, output, outcome logic model. But the thing to note pretty much is that historically, research agencies stop when they do their research. They publish the research, they think they're done. The R2P process encouraged us to move and to think downstream, to the distal parts of the continuum, to the end outcomes. So did it make a difference in reducing morbidity, mortality, and injury rates? Well, you can't always get all the way downstream, and so you have to look at various kinds of intermediate changes. And so the evidence that we adduced to be evaluated for these programs was, for the most part, intermediate outcome kinds of evidence. The National Academies also established a committee to lay out the whole groundwork for how the evaluation would be conducted, and they published this treatise on that. So they were a framework committee, and their framework was very important in keeping a consistent review all the way through. And then the programs developed, based on this framework, an evidence package that communicated what they did and what the impact of that was. And NIOSH asked the National Academies to give us a numerical score for the impact of these programs, and we asked them to assess 2 characteristics: relevance and impact. on a 1 to 5 score basis. So a score of 5 for relevance is that research is in high priority subject areas and that the NIOSH program is significantly engaged in appropriate transfer activities for completed research. And for impact, a score of 5 is that the program had major contributions to worker safety and health on the basis of end or well-accepted intermediate outcomes. And so this is sort of a flow of the activity. What makes this a unique kind of expert review is that it had many facets. So in addition to the National Academy convening groups of scientists to review the program, then NIOSH, they also convene a second independent review that used up to 185 scientists to then re-review what the first group did. Then NIOSH asked its Board of Scientific Counselors, which is its main scientific advisory board, to review the extent to which the NIOSH programs took the recommendations and developed a plan to implement them. And so they evaluated the implementation plan, and then a couple years later, they evaluated the extent to which that implementation plan was carried out and the extent to which it made further impact. And it assessed these programs in terms of relevance, sustainability, progress, and potential impact. So it wasn't just a one-shot expert review effort. It was review, recommendations, program takes them, considers them, assessment of that whole process, and then the outcome. And so if you're going to do an expert review effort, approach, and impact assessment, one of the ways to get the most out of it is to assess then what the reviewed group does with the information, and that's what we tried to do. And the National Academy published the responses to each of, or published the results of the reviews for each of the 8 categories. Here are 3 of them. I'm going to drill down to the center one, the respiratory disease program, to just give you a little bit of the flavor of what's in it. So the respiratory disease program had these as established goals. They wanted to prevent and reduce work-related airway diseases, interstitial lung diseases, respiratory diseases, respiratory malignancies, and then they wanted also to prevent respiratory and other potentially injurious effects of occupational exposure to the newly emerging area of nanotechnology and nanomaterials. For the most part, all the scores that the National Academies gave to that program were 4s or 5s. The score of 5 for relevance, and the Academy said the activities related to sub-goals that were of the highest priority. They were highly relevant goals to improvements in the workplace, and the program engaged in transfer activities at a significant level. And then they wanted to give even a higher score than 4, but they only had whole integers, and so they said for impact that most of the sub-programs have made major contributions to worker health and safety in terms of well-established and end outcomes. Okay, let me go now to another critical thread in our impact assessment. This is the second decade of NORA. So NORA started in 1996 and went to 2006. That was the first decade. Then the second decade started in 2006 and goes to 2016. And so we're in the process now of conducting a review of the impact of this decade. We're going to look at 10 industrial sectors and 24 cross-sector programs. And here's what what those cross-sector programs look like. And essentially, this review will be conducted on the basis of getting answers to these 3 questions. What did NIOSH do? How well did it do it? And what was its impact? And these will be asked across a variety of domains, so they will involve interviews with the sector council members for each of the sectors, for the leadership groups in the cross sectors. They will also involve extensive interviews and questionnaires to partners and stakeholders. And then they involve an assessment for each program that's being assessed, a review of every intermediate goal that that program has, and many of them have dozens, and then the extent to which that intermediate goal has an intermediate outcome. And so it's essentially an assessment at the nuts and bolts level of the programs. And then also it involves a bibliometric analysis. So this won't be as extensive as the National Academy's review of the first decade, but it indeed will be a way that we can assess to what extent this second decade is making an impact. Now I want to show you an example of just one aspect of impact assessment that we're working on, and this is the assessment of our Nanotechnology Research Center. I also manage that in addition to my other position. And if you're not familiar with nanotechnology, we are early in the natural history of workers handling nanomaterials. So commercial nanotechnology started in the early 1990s for all intents and purposes. In 2004, NIOSH established a nanotechnology research center. And I just wanted to show you two levels of impact assessment that we did. One was a sort of a pre-impact assessment, if you will. So since we're early in the natural history of this new technology, there was much uncertainty about whether nanomaterials were a hazard, how to measure them, what metrics to use, and so forth. And so we developed two strategic plans separated by about 8 years. Each of those were then reviewed by a group of scientists headed by our board of scientific counselors and supplemented by ad hoc groups of scientists. We then modified those strategic plans based on the scientific review, published 2 progress reports coming out of them. But I wanted to show you this slide because this is, in a sense, a bibliometric analysis, but shows you another assessment of impact. There's a lot of bibliomania going on right now where many people think that a bibliometric approach is the end-all and be-all of impact assessment. But it's just one tool that can be used. So this shows a period of time. The green line are the number of NIOSH publications. The blue diamonds are the extent to which they're cited. The red line shows the average that an article in a journal is cited, and it shows it over 11 journals where NIOSH publishes much of its research. And so you can see for the most part that NIOSH research is cited much more than the average in those journals. And critically, in impact assessment in occupational safety and health, while we want to move employers to action, we also, as a research agency, want to move the science. And one way you move the science is by having your research cited. So this was another strand in our approach, and we've done this in numerous programs. And then also, in addition to a bibliometric approach, it's not enough just to give guidance. So we and other agencies around the world gave guidance for this new technology that employers should take precautions, and we specified what those precautions were. It's not enough just to do that and to show that your research is cited. We're now in the process of conducting a national and an international survey with the International Commission on Occupational Health to assess the extent to which employers have adopted that precautionary guidance. And we believe that that is a critical intermediate outcome that will be on the pathway between exposure and health hazard to workers. And the last effort I wanted to talk to you about was the development of new impact metrics. NIOSH engaged a resource in the federal government known as the Science and Technology Policy Institute. It utilized a multi-method approach and reviewed 4 programs within NIOSH as representative of what we do so that they could think of what kind of metrics might be valuable to assess the impact of those programs. And they were of 4 types: basic research, intervention research, translational research, and surveillance. And as you can see, these are linked together, and as you well know, in a continuum of efforts. And the STIPI, the research group that analyzed these, came up with 2 major recommendations, among others that I wanted to show you. And these 2 are these. One is that, and this didn't strike me as being very far-reaching, but it does have a certain earthiness to it, that NIOSH should consider focusing its research on measuring outputs and short-term outcomes that are dependent on most of its activities. So you can see that they don't believe that we can really measure end outcomes, and they don't think we could do a very good job of measuring intermediate outcomes. So they said, stick with what you know and measure short-term outcomes. Well, I think this is good counsel, at least in terms of giving us a foundation to work with. I think our challenge, as I'll talk about next, is figuring out how to work in this part of the continuum. Their second recommendation was that we should consider applying different metrics for different types of research. It seems to be a no-brainer in some regards. One size does not fit all. So that was sort of what we've been doing at NIOSH. Now let me take a few minutes and just give you a little bit of perspective on where I think the whole area of impact science needs to go. And I think we need to think about the term or the concept of having an impact science and bringing scientific methodologies and approaches to assessing impact. Too often it's been catch as catch can. You look who cites your work. You see what legislature has talked about something you've done. But we need to have a more precise science to look at that. And it's not as if there isn't a rich history. We have more than 50 years of practice in program evaluation and knowledge and research utilization. And there are great methods, and we need to continue to utilize those methods. For the most part, a lot of the approaches have utilized this highly simplified logic model of inputs, outputs, and outcomes. But as Cousins and Bordagari have pointed out, the models that depict this space between the outputs and the outcomes are immature. They're underdeveloped, and that's where we need to put more emphasis. I think in occupational safety and health, we've invested too much at the ideologic end of the spectrum, rightfully so when we did it. But now it's time to figure out what works and what difference does an intervention make given complex scenarios. And so we need to focus our attention and our resources at the distal end of the continuum. We know that this is difficult because the linkage between outputs and outcomes is mediated by a lot of factors. It's a result of interactive processes. We don't control what happens in the company. We don't control what happens on the factory floor at the workplace. And so we need to figure out ways to assess how change is made in that regard. And then we need to think about this. This is Cousins again talking, Susan Cousins talking about the knowledge pool. And she says, as soon as they are produced, the outputs of research activities join the pool of knowledge and human resources that is fed not just by one agency's activities, but by numerous agencies. And we can track the outputs of what we fund into the knowledge pool, but eventually if we try to track each drop or each output and what they've contributed through the knowledge pool, we'll end up spending more money on tracking than doing the research. So we need to have a certain balance here But I think we're way underinvested in this end of the continuum of thinking about how to study impact, how to bring scientific methods to it. So we need to improve impact science and define it better and figure out what kinds of capacity building, what kinds of methods, what kinds of approaches we can use. It hasn't been our focus in the past, save for some notable exceptions like IWH and other organizations. And we need to develop the tools, methods, and designs. And it's not just so that we can say we're doing the most important things and we're making a difference. It's so that we can make a better difference by taking the results of that impact assessment, feeding it back into our outputs and our translations so that we can then influence, make a better impact than we are doing. So I think that's our challenge. I think many in this audience are the people who will be the early adopters of that challenge, or have been the early adopters. And I think if more in our field get involved with this, that we will be able to look back and say we are making a difference and we can demonstrate it, and continued societal funding of these efforts is critical. So with that, I'll be glad to discuss this with you and try to answer any questions that you might have. Thank you.